Faced with an alarming increase in the amount of Cantabrians seeking help for their mental health, the CDHB has made a deputation at the Christchurch City Council's Housing Committee meeting today. Over the past 3 years, the CDHB has seen the demand for services increase by up to 80%.
So we're seeing increases for child and adolescent services of 40% in the last 3 years. In our adult community services, we're seeing increases of 30% and 37% for psychiatric emergency services. So that's pretty alarming to us. We think that's a reasonable indication of the level of distress in some parts of our community.
The plea for help comes a fortnight after CDHB Chief Executive David Mates warned without further funding, Christchurch will be in the middle of a mental health crisis. David Mates says the huge growth in demand for mental health services is showing no sign of slowing down and is unsustainable. He says the service has grown tenfold since the earthquakes. Right now, more than 5,000 people are underneath the CDHB for mental health care.
We had an initial decline in demand for mental health services after the quake, 6 to 9 months, but ever since then we've seen unprecedented increases.
Recently, during the worst period the hospital has seen, 64 beds were full and another 87 people with mental health problems were underneath the care of hospital staff.
We're really concerned. We're in some parts of our mental health sector are absolutely stretched to capacity. We have absorbed a lot of the increases to date, but we're concerned about our ongoing ability to do that, particularly with the housing shortages.
Currently, at least 5 patients are homeless and have nowhere else to go, and there are fears other patients could be put at risk due to a lack of available beds.
And people are remaining in inpatient services for longer than they need to, just because they don't have housing to move out to.
Extra community services to help patients once they leave the hospital are urgently needed, but there's no money left in the budget for this. The Health Minister is backing the CDHB in its request for further funding, and today the Council heard how urgent accommodation is needed to help some vulnerable patients once they leave the hospital.
It's a supply of housing that's affordable for people on low incomes, and it's about the movement through the emergency housing system, which again is linked to supply.
Meanwhile, the Housing Committee has also heard from the Ministry of Social Development. MSD will soon be contracting Christchurch-based housing NGOs to provide additional temporary accommodation for people needing emergency housing. The initiative will provide short-term accommodation for up to 8 weeks for 40 vulnerable households at any one time. This could include leasing properties such as motels to provide temporary respite as the repair and rebuild of Christchurch's housing stock continues. The Ministry is aiming to have this short-term housing response running by September. It will run for 2 years and complement the short-term accommodation the Christchurch City Council is planning to set up at the former Christchurch City Mission Night Shelter. Marcus Gibbs, CTV News.